Hey everybody, today we're going to take a deep dive into anxiety, what causes it, and how to get rid of it. Now of course, we're always going to have anxiety when there's a good reason something needs to be done that we're not looking forward to or we can't figure out right now. But there's a type of chronic anxiety, and that's really what we're concerned with today. So you're looking at the Ultimate Herbal Database. I'm going to walk you through a lot of this. Now, in holistic medicine, we understand how really everything is connected. And I try to show that in the database so we don't miss anything that's important. We also understand that in order to effectively treat anything, we need to get to the root cause. So that's where we're going to start today, looking at some of the root causes of anxiety. I'm going to open up the info panel by clicking this little arrow, and that's the info panel for anxiety. And let me just scroll up a second just to show you that there are quite a few videos here that are really good, and there are more videos on these tabs and articles, so there's plenty for you to go through. But even in today's video, you're going to get a really good start on how to handle this. We see here in the text session that elevated stress hormones can cause this or make it worse. And also, like depression, anxiety can be a learned behavior. Growing up in a household with an anxious parent increases the chances of an anxious child, and that can stay with us for life. There can be genetic components. Some medications and even recreational drugs can make it worse, like amphetamines, cocaine. And there are some medical conditions, including Graves' disease, anorexia, Alzheimer's, PMS, and menopause, that are well known for causing anxiety. So I'm going to close this back up, and we're going to start over here on the left with looking at causes. In the database, generally, anything over on the left is going to be causal. So let's just start with this. That pink color means that this has to do with part of our physiology. And in this case, cholecystokinin is a hormone that plays a role in anxiety. Now, it does a lot of other things having to do with our digestion. It's concentrated in the wall of the upper small intestine, and it's secreted into our blood when we eat proteins and fats. Now, in herbalism, we use a lot of bitter herbs for digestion, and they can also be used to help us with anxiety because they act directly on this cholecystokinin. Cholecystokinin, we see here, augments symptoms of fear and anxiety. So plants that reduce anxiety have been shown to bind to the receptors for cholecystokinin. They kind of dampen it down. And this is really interesting. If you've ever heard of Gotu-kola, one of the things that it does is it attenuates the startle response in people. Have you ever felt anxiety or fear in your stomach, in the small intestine area? This hormone could be playing a role in that. Interestingly, carbohydrates, the right carbohydrates, dampen the amount of cholecystokinin. That may be why when we feel anxious, we want carbs. So let's go back to anxiety, and let's look at another one, tryptophan. I'm sure you guys are familiar with this amino acid. We're often told that it's something that we can use to sleep better at night. But there's something very interesting that happens with tryptophan. We have these biochemical pathways where one biochemical is turned into another one, and then turned into another one, and so on. And these are all very distinct pathways. So with tryptophan, in the preferred pathway that we want to have used, it turns into serotonin. And that serotonin is turned into melatonin. So when that pathway is active, we feel happy, we sleep well, we wake up refreshed. As a result of normal aging, inflammatory cytokine levels increase. Now, cytokines are chemical messengers. Some of them increase inflammation. So one of the effects of those inflammatory cytokines is it causes the induction of a tryptophan degrading enzyme called IDO. Now, IDO enzyme is activated by stress, infections like parasites, or fungal overgrowth in the gut, pathogenic bacteria. And when that happens, the pathway switches. We're no longer using tryptophan to make serotonin. Instead, it goes to another pathway, the kynurenine pathway, and once it's active there, instead of making serotonin, it's used to make kynurenine and quinolinic acid. And that quinolinic acid is the bad guy because it affects neurotransmitters in the brain, which is excitotoxic. It can excite cells to death. And when that's happening, as you can imagine, folks are anxious, stressed, and they can't sleep. It's a difficult pathway to reverse. If you give people tryptophan or 5-HTP, both of those are supposed to make serotonin, they're going to feel worse. And that's because the kynurenine pathway is just going to get faster, and you're going to be making more quinolinic acid instead of serotonin. And that's why for some people the SSRI drugs don't work, because they're feeding that kynurenine pathway and they're converting it into quinolinic acid. Here in this section of the database, you will have instructions on what you can do to help switch tryptophan back over to the correct pathway where it's making serotonin and then melatonin. I'm not going to go through all of this, but just point out a few things. Niacinamide will help. Lysine, the amino acid lysine. I'm going to encourage you guys, of course, to subscribe to this and read it for yourselves, because we don't really have time for me to read through all of this. Curcumin helps with that. And then there's some cofactors that help tryptophan to switch over to serotonin in the brain. That's vitamin B6, magnesium, and vitamin C. So this could be one of the things that's going on. If you are having a lot of stress, your tryptophan isn't making serotonin. And it doesn't matter how much tryptophan you take, you're not going to make serotonin. You're going to make more excitotoxic quinolinic acid that is going to kill cells in the brain, and you're going to feel worse. Now, if you look over here on the left, you might notice resveratrol. That's one of the herbal supplements that helps tryptophan move along the correct pathway. Another common cause of anxiety is when we've been stressed for a long time, we can have elevated cortisol, chronically elevated cortisol. And so, as you see over here, that can be the cause of a lot of things like cancer, irritable bowel syndrome, common cold even. And of course, we have herbs that are used to lower cortisol. But let's go back to anxiety. And I want to show you one of the best places to get started. In herbal medicine and functional medicine, we pay a lot of attention to diet, lifestyle, that sort of thing, to the point now where we have a whole new field called nutritional psychiatry. This is being used to treat a wide range of psychiatric problems, everything from anxiety to schizophrenia and depression, etc. It's pretty exciting, actually. So they've realized that our brain is affected by its molecular environment. And if there are localized cerebral deficiency states, and we're talking about deficiencies of neurotransmitters that require certain substances, and we don't get those in our diet, we're not absorbing them, or maybe they're just not being transferred properly across the blood-brain barrier. Maybe there's an increased destruction of vital substances in the cerebrospinal fluid, or defects in enzymes that govern those reactions. So the goal here is to use nutrients to treat these deficiencies. And when that's done properly, these important neurotransmitters are able to function properly. You can do lab tests to find out where the deficiencies are, and then use the right doses of the right nutrients to correct them. And this can even overcome or help overcome some genetic hurdles. So these are some of the really important neurotransmitters that could be playing a role in any kind of mood disorder, anxiety, psychological disorders. Let's just scroll down and get started with some of the important nutrients that are used in nutritional psychiatry. One of the big ones is the use of amino acids, and those are being used to increase the number of neurotransmitters available to stimulate the next cell. There's a big difference between using amino acids and medications, and what that is that medications do not build up more neurotransmitters. Instead, what they're doing is working as enzyme blockers. They block the breakdown of these neurotransmitters. So what's supposed to happen is that once a chemical is released and it's done its job, enzymes break it down to get it out of the body or recycle it. But medications block that to keep the chemical hanging around longer. And those are old used parts. The drugs that prevent neurotransmitters from being taken back up in the cell are keeping around used parts. It's the amino acids that bring in the new parts, the new neurotransmitters. And then here's a section comparing drugs to amino acids, but let's just talk about some of the important amino acids that are used. Two of them are phenylalanine and tyrosine. There's sometimes people know to use those, but they don't take enough of them, or they take them with other amino acid products. Phenylalanine is converted into a whole bunch of different amino acids. For example, it's converted to tyrosine, and that's converted to dopa, and that's converted to dopamine, finally to norepinephrine and epinephrine. So just from taking one amino acid, you get several others. Now with tyrosine, that can be a little bit risky. Probably it's best just to take the phenylalanine, because tyrosine can produce stress neurotransmitters, and I'll leave it to you to read through that part. Then another important nutrient would be the fatty acids. With fatty acids, you make these chemicals called second messengers that allow chemical reactions to occur in the nerve cell. There are anti-inflammatory prostaglandins that suppress the cytokines in the nerve cell. Omega-3 fatty acids are really important. The cell receptors function largely because of their fatty acid makeup. But if you're eating a lot of junky fatty acids, those are in the membranes and your receptors aren't working well. So that's another key thing. What kind of fats are you eating? Are they healthy? To find out, of course, you can come in the database and go through all of that. Now here's another important protein that supports the growth of neurons through our adulthood, brain-derived neurotropic factor. The omega-3s support its production and also keep it around longer. If you don't have enough, depression is quite likely to crop up. So having your omega-3s to keep that brain-derived neurotropic factor going is important. Chromium enhances insulin sensitivity, and that increases the entry of tryptophan into the central nervous system. Tryptophan is one of the hardest amino acids to get pushed into the central nervous system because it competes with all of the other amino acids. Chromium works best if you're depressed and crave sugar. Folate is another one. It's something that's called a methyl donor. We won't get into all of that, but in order to make neurotransmitters, we're not done. We require methylation. And folate increases central nervous system serotonin levels. It helps us make every single neurotransmitter. People who are depressed should consider high-dose folate. In general, there's no adverse effect with high levels, but there could be toxicity. If you are taking folate or trying to get more of it, avoid black or green tea because that will inhibit absorption. All right, let's move on to B12. If that's low, there are still problems, and that can be low in not only vegetarians, but as we age, we don't absorb enough. People who are on proton pump inhibitors are probably not getting enough. Vitamin D3 plays another role. They've even found that EEG brain readings change with the seasons. Depression scores are worse in the winter. Liver and kidneys need to be healthy because they convert vitamin D made on the skin into active vitamin D. If you have any kidney or liver problems or aren't outside, you do need to take it. Most of us are taking it these days. The brain has vitamin D receptors. So let's go back to anxiety, specifically for the nutritional supplements that we also need to pay attention to for that. So here we are. People with anxiety have high levels of lactic acid, and that can relate to shallow breathing and tight muscles. So to help, vitamin B3 as niacinamide that calms and enhances something called GABA. It works like benzodiazepine in increasing serotonin, and it decreases that lactic acid. People can have subclinical pellagra, by the way. Magnesium is another one to pay attention to. It does improve anxiety and anxiety-related disorders. And most of us these days don't have enough magnesium. Case studies show improvements in depression, anxiety, and sleep within 1 week of magnesium supplementation. Those R's are all the references. You can click on it and go to the study. Niacinamide as the form of B3. We already mentioned it once. 2,000 to 4,500 milligrams a day with food. There can be some side effects. Don't take more than that because it causes glucose intolerance at high doses. Here's the figure you want for B12 in your blood. 1,000 to 2,000 picograms. L-lysine can help. Now this is only to be used in an acute situation like a panic attack. If you have panic attacks, check this out. It can be used to antagonize stress hormones quickly. The dose is 2,000 milligrams to 10,000 milligrams, up to 30 grams a day, in divided doses. Inositol is a sugar alcohol. It's found in foods. It's quite sweet. It works as a signaling molecule in the nervous system, and it's used by a lot of our nervous system receptors. It helps with panic attacks as well. You can take higher doses if you have panic attacks, but taking lower maintenance levels can help prevent panic attacks. It's made in the kidneys and in the gut by friendly bacteria. Here's some studies. Daily inositol supplementation reduced panic disorder, anxiety, and OCD symptoms in children and adults. There are some doses. Multivitamins don't have enough of it. Then another amino acid for anxiety is L-theanine. Now you do find that in green, black, and white tea, and it's calming. When it's taken after the performance of mental tasks, it lowers stress symptoms, heart rate, and blood pressure. Daily L-theanine supplementation reduced anxiety in this one study of 20 schizophrenic patients and helped relaxation in 20 healthy people. It increases brain GABA. GABA is something that helps us relax, and here we have more about GABA as a supplement. If you're going to use GABA as a supplement, I recommend something like PharmaGABA. That's an actual product. You can click on that because GABA doesn't cross the blood-brain barrier when it's taken orally, but this product does. Now 5-HTP, remember here that we just discussed the problem with 5-HTP, that if your tryptophan is going down the wrong pathway, that you're going to be making quinolinic acid. So you have to deal with that first. Make sure that your tryptophan is being used for serotonin before you use 5-HTP. Apigenin is a flavonoid. There's a lot of it in chamomile. It lowers mild to moderate levels of anxiety and depression and stress. It enhances GABA communication by binding something called the benzodiazepine receptor. I know you've heard of benzodiazepine. Now we also have behavioral strategies. Anxiety isn't just about our chemistry. We also have a mind-body relationship so that our thought processes can be influenced by the chemicals in our body and vice versa. So by changing the way that we're thinking, we can overcome certain habits of anxiety that are kind of locked into the brain through different parts of the brain, like the amygdala or the basal ganglion or the prefrontal cortex. So here are some behavioral strategies that will help unlock some of that. And it's a good idea to blend them. If you have chronic anxiety, I would suggest using some of these strategies for the use of nutritional psychiatry, and we're going to get to the herbs in a minute, but also combine it with these behavioral strategies. So what are they? We've got cognitive behavioral therapy. If you look over on the left, you'll see it's attached here, cognitive behavioral therapy. I'm just going to go ahead and click on it. We have quite a few videos that explain what it is, but it's been very effective for anxiety, depression, and a number of different psychological problems. So let's just scroll down here again and go back to that. It's the most widely used evidence-based strategy for reducing anxiety. And there are some computer programs that are out where you can use it at home. It helps you develop coping strategies to solve current problems and modify unhelpful cognitive patterns like thoughts, beliefs, and attitudes, emotions. It's great if you can have a therapist, but you can use self-guided internet-based programs, and it's been effective. There are studies here that show that people using it on the internet have good results. There's also mindfulness meditation. Again, you can learn more about it. If we go over here, this light green color signifies healing therapies. And so here's mindfulness practice. There is training in this section of the database, as well as studies. So it helps us pay attention to what's happening in the present moment. And we can do it through the day just by being tuned into what we're experiencing. It's often developed through meditation, but it doesn't have to be. It's a form of mental training that helps us get our attention under control, and that helps with emotional control. It's attention focused. Even yoga helps. It reduces anxiety by improving what's called the HPA axis function and increasing GABA again. It lowers salivary cortisol. By doing that, you get reduced depression, anxiety, and perceived stress. Physical exercise. That has lowered anxiety, neuroses, depression, while physical inactivity is associated with increased anxiety. Exercise reduces anxiety symptoms in those without a diagnosed anxiety disorder. It reduces inflammation. It improves and increases brain serotonin, dopamine, norepinephrine, and endorphins. It increases BDNF. Heart rate variability biofeedback training reduces anxiety, and that training is available through HeartMath. What it is a measurement of how much your heart rate deviates compared to average. So the higher heart rate variability, in other words, more inconsistent, it varies between 50 to 75 beats per minute at rest, is desirable, and it indicates dominance of the rest and digest nervous system, the parasympathetic. A lower heart rate variability, and that's where it stays between 65 and 70 beats per minute, like a metronome, indicates dominance of the sympathetic or fight or flight nervous system, and that's associated with stress and inflammation. So we can train ourselves to maintain a good heart rate variability. I suggest you take a look at HeartMath. They have some devices, biofeedback training devices, that are quite good. A little bit pricey, but good. Let's go down to applied relaxation. This has been around for a long time, and that is where we develop relaxation skills through diaphragmatic breathing and progressive muscle relaxation. These techniques are applied in response to the very early sign of anxiety. There's also here a computer-delivered applied relaxation that was shown to be as effective as therapist-guided. Then there's cognitive bias modification. So we talked already about cognitive behavioral therapy, and that teaches people how to deal with thoughts as they arise. What cognitive bias does is it attacks thoughts earlier in the cognitive process. Biases towards a threat that are commonly found in anxious individuals include something called attention bias. That's where we pay preferential attention to threatening information. Interpretation bias, where there's comprehending emotionally ambiguous information as being more threatening rather than neutral. And memory bias. That's where we store or retrieve threatening information more often than neutral positive information. So what this does is basically it's retraining all of these above biases using computerized tasks. It lowers anxious behavior at clinically relevant levels. In fact, it can be more effective than cognitive behavioral analysis. Now, healing your gut microbiome can reduce anxiety. And for that, we have a huge section on the gut microbiome, and you can go there to learn more about that. Sunlight helps. Infrared sauna can help. And then we have some studies to close out this section. But now I want to go back to this main screen and just point out a few other things. A weighted blanket. That is something where pressure on the body helps reduce anxiety. And let's see, massage therapy. Guided meditation, detachment from anxiety. That is an actual guided meditation in the database that you can use. Probiotics for anxiety. Let's take a quick look at that one and open it up. There's something now called psychobiotics. That's a class of probiotics that help people who have psychiatric illness. It helps produce and transport neurotransmitters. There's two types of bacteria, Lactobacillus and Bifidobacterium, that have been studied in the treatment of anxiety. They inhabit the gut and are involved in carbohydrate energy conversion. So here's more on these: Lactobacillus plantarum, Lactobacillus rhamnosus, Lactobacillus helveticus, and then this particular bifidum. So these are very specific types of probiotics. And again, for example, if you wanted to learn more about this one, just click on that link icon and it takes you over to this section on Bifidobacterium longum, and you can see a range of things that it helps with, like allergic rhinitis, irritable bowel syndrome, etc. SAM-E can be helpful. Now, for young children who have anxiety problems, this Mind Light is fabulous. It's a kind of a biofeedback computerized game that helps children up to about age 12 learn how to handle anxiety in a healthy way. And then Panchakarma is an Ayurvedic detoxification therapy that can be used. These two purple ones are phytochemicals, so beta-caryophyllene helps, and so does CBD oil. Let's go over to herbs for anxiety. Here we have a number of really important herbs. So ashwagandha has effects on anxiety that are similar to those of standard benzodiazepines. If you take ashwagandha at night before you go to sleep, it helps to keep the high cortisol levels down. This Withania complex is a good formula. Ginkgo is another one. A supplementation of 240 or 480 milligrams daily for 4 weeks lowered anxiety symptoms compared to a placebo in a 107-person study. In elderly people, it helped reduce anxiety, depression, and even dementia. And of course, it's so super healthy for rats. Gotu-kola. So many good things about gotu-kola. One of the many things that it does is it lowers anxiety-like behavior, and I already mentioned it helps people keep from being startled. Bacopa, also called Brahmi, an Ayurvedic herb. That's something that's fat-soluble, so you take it with a meal. Here are a few studies that show how, for example, this one for 12 weeks, it improved the state of anxiety compared to a placebo. That's a human study. It reduced cortisol and stress in 17 healthy humans. It reduced mixed anxiety-depressive disorder. It increases norepinephrine, serotonin, and dopamine in the rat brains. Maybe it does that for us too, who knows. Black seed. It stabilizes mood, decreases anxiety, and improves cognitive function, according to this study of 24 adolescent males. The oil improves inflammation, blood pressure, and anxiety without noticeable side effects in animal and human studies, and you can see there are several studies linked here. Hops is also good. One thing about that, it is phytoestrogenic, so this is where you need to do your research, because some people, for example, estrogen-sensitive breast cancer, might want to avoid that. Kava helps, and it's comparable to benzodiazepines. In fact, a comparison of herbal anti-anxiety remedies shows that kava is more effective than most of them in reducing anxiety. Lemon balm also, it's very calming. We see how much to take as a supplement for mood and anxiety. Partly it's effective because of its rosmarinic acid. That increases GABA. It increases GABA by blocking an enzyme that's a common target for anxiety treatment that converts GABA to L-glutamate. Lavender. I think a lot of you folks know about that. The essential oil is particularly good. It improves sleep and it slightly increases GABA. Magnolia, when we buy that as a supplement, it's usually sold as hinokiol. It lowers depression and anxiety in animals, and it's used in Chinese medicine. Purple passion flower. We're very familiar with that here in Arkansas, Passiflora incarnata. It reduces anxiety similarly to benzodiazepine in 18 patients with generalized anxiety disorder. Another really interesting study was done on using it before surgery to lower anxiety, and that's been a problem because they've been looking for something that they can give patients before surgery to reduce anxiety that is not going to interact with the anesthesia. And it turns out that passion flower did just that. There was no problem with any kind of interaction. They took it 90 minutes before surgery, and it brought the anxiety down to almost zero. And we see another study that was done taking it before public speaking. I really like passion flower. Skullcap is another one. It's been studied and shown to decrease anxiety. There's Chinese skullcap. It also reduces stress-induced anxious behaviors and blood corticosterone in animals. One of the active flavonoids in it, in the Chinese skullcap, is woganin, and it reduced anxiety behavior too. Valerian, by the way, combining valerian and passion flower is a really great combination to improve sleep. So it also works with the GABA, in this case GABA A signaling. And then down here we have some differentials from David Winston. As you can see on the left, we've got so many herbs that act in different ways to reduce anxiety. So how do you select which one to use? In this section, we see that the fresh bacopa is very useful for cloudy thinking, mental confusion with anxiety, nervous exhaustion with agitation, and for hypothyroid-induced depression. There can also be hypothyroid-induced anxiety. Black haw, this is anxiety associated with pregnancy. Use it with oats and rescue remedy. Blue vervain for PMS or menopausal anxiety. Anxiety with nervous tics, tremors, or spasms, and you can combine it with motherwort and pulsatilla. Cactus stem, that's serious. Here it's for the people who are nervous, sleepless, they feel oppression in the chest, and dyspnea, that's difficulty breathing, and they have fear some important function is going to cease, and they're going to die. California poppy is another really good one. It's good for people who have excess hyperinsomnia with anxiety, nervous tension and stress headaches. The Chinese polygala root, very effective, used with motherwort and blue vervain for general anxiety, and with pulsatilla for panic disorder. Also for insomnia, anxiety-induced palpitations, impaired memory. You can turn towards milky oat seed for nervous exhaustion with anxiety. Ginkgo we've already discussed to some extent. Really good for anxiety in the elderly. The gutang spine, that's for anxiety with spasms, tics, and tremors. For stress-induced bruxism, headaches, white coat hypertension, and here's some other things to combine it with. Hawthorn fruit and flower, and again some combos. Combine it with cactus, that's serious, and motherwort for anxiety-induced heart problems, sadness, grief. The hops we already touched on, more specifically for nervous irritability or mild anxiety with wakefulness or gastric upset. Kava, and here's some combinations. If somebody has restless leg syndrome, that's a good one to choose. Lotus seed, anxiety, excessive or disturbing dreams and insomnia, and here are some more combinations. Mimosa flowers and bark, bad dreams, fears. The Withania complex that I mentioned earlier, it's good for people who are wired but tired. It has licorice skullcap and Korean ginseng in it. It is contraindicated though for people with hypertension, congestive heart failure, low potassium levels. or water retention because of the licorice. And then here are a few other treatments that you can look at. Okay, so I'm just going to close the info panel up so that you can see all of the range of herbs that can help. To finish up, I just want to show you a couple more areas. Essential oils. These are all oils that have been tested not only through our own experiences but in various types of clinical trials, and they've been shown to relieve anxiety. And one more stop along the way. Let's just see what is considered to be an anxiety disorder. Phobias, PTSD, social anxiety disorder, panic attacks, OCD, and of course, generalized anxiety disorder. That's kind of what we've been focused on in this video. Psychobiotics is located there because it's useful for all of these anxiety disorders. So, my friends, that's it for this video. I hope you will subscribe and join us on Herbal Knowledge Keepers. You can leave comments below, questions, etc. And you've already seen how to subscribe to the database. I'm going to just let you know for a very short time, I'm offering a 2-week free trial. So jump into it, get that anxiety under control, and live a happy, peaceful, healthy, joyous life. Bye-bye.